welcome everyone and good luck to all of us. Thank you very much.
Thank you very much, Ms. Garcia, for the welcome message. So, as Garcia said, this will be a very interactive session for all of us. Therefore, we are really into a limited number here in our platform right now. So, just to have an interaction in the succeeding session of our workshop, just make sure to raise your hands or just put it on the chat box whenever you really need to ask questions or use our Q&A button. Okay, so we'll move on to the program itself proper. We have a 2-speaker for this morning and then another 2-speaker for next tomorrow. All right, so it is my honor to introduce our speaker for this session. So she is a graduate of Bachelor of Science in Pharmacy at the University of Santo Tomas, and she is a trained professional in licensing of drug establishment, outlet by the Bureau of Food and Drug. Also, she is also trained as an oncology pharmacy, including the safe handling of cytotoxic drugs at Cardinal Santos Medical Center. She is involved in various clinical trials and worked in a range of other roles in the clinical research. Currently, she assumed the role of the oncology pharmacist of the Comprehensive Cancer Care and Research Center of Cardinal Santos Medical Center. Right, to discuss the first session for this morning entitled Safe Handling of Hazardous Drug Preparations and Compounding, please welcome Ms. Ronalie San Juan.
Hi, good morning. So I'm Ronalie San Juan, oncology pharmacist from Cardinal Santos Medical Center. Then I will be discussing safe handling of cytotoxic drugs, preparation, and compounding. So the objective of this presentation is to promote a safe, healthy, and organized workplace for all the staffs involved in the preparation of chemodrugs. To be aware of the risk in handling exposure to cytotoxic drugs, to know the preventive measures in minimizing or eradicating the exposure, to be able to demonstrate proper PPE, and to know the proper handling of cytotoxic spills. So first, what are the cytotoxic drugs? So these are also known as antineoplastic drugs or cancer chemotherapy drugs. They have an effect of preventing the rapid growth and division of cancer cells. However, cytotoxic drugs also affect the growth of other quick dividing cells in the body. As a result, in the treatment, many normal cells are also damaged along with the cancer cells. So these drugs affect all dividing cells, including those of healthy tissues. But because cancer cells often divide markedly faster than normal cells, they are particularly sensitive to cytostatics. The effect on normal cells are less pronounced, and healthy cells are also recover faster. So the International Agency for Research on Cancer Risk classified this cytotoxic drug according to group. So for group 1, which are proven carcinogenic, there is a sufficient human evidence of carcinogenesis. So example of these are the cyclophosphamide, which we often use, the etoposide, and the tamoxifen. Under the group 2A, which are probably carcinogenic, so there is a limited evidence of carcinogenicity in humans and sufficient evidence of carcinogenicity in experimental animals. So examples are cisplatin and doxorubicin. So for group 2B, which are possible carcinogenic, so there are limited evidence of carcinogen. So there are limited evidence of carcinogenicity to experimental animals and also to human. So examples are bleomycin, dacarbazine, and mitomycin. So who are at risk to exposure to chemotherapy drugs? So the physicians who handle the patients, and sometimes these physicians also compound and administer the cytotoxic drugs in their respective clinics. The pharmacist who compounds the chemotherapy drugs, the nurses who administers, the nursing aide who handles the linen and the bedsheet used by the patient, the housekeeping who cleans the area, and the relatives of the patient, and also the warehouse, also our warehouse staff. So all of these are possibly exposed to cytotoxic drugs. So NIOSH, he said job titles that may involve exposure to hazardous drugs. So number one in the list are the pharmacy and the pharmacy technicians. Next are the nurses, and then the physicians and the physician assistants. So we should understand the risk. So why do we need to determine who are at risk to these cytotoxic drugs? Why do we need to pinpoint the personnel at risk? So these cytotoxic drugs have an effect on normal. These cytotoxic drugs have an effect to normal being. So they can be carcinogenic, teratogenic, genotoxic, and they can cause fertility impairment and organ damage. So the routes of exposure to these cytotoxic drugs could be dermal absorption. So sometimes hindi tayo sigurado dun sa mga surfaces na iniiwan natin kapag nagko-compound tayo, and also the garbages na kung saan natin dinidispose yung mga chemodrugs natin. Then inhalation due to accidental breakage, and then non-use of mask, then accidental injection or yung needle stick injury natin, and ingestion. Sometimes if we do not wash our hands after compounding, we could possibly ingest these drugs. So these drugs have an effect. The effects of this exposure could be acute. It has direct irritant to mucous membrane, eyes and skin, soft tissue injury, dizziness and lightheadedness, and nausea. So chronic effect niya could be inconclusive and little known of the long-term effect. So the possibility that the carcinogenic threshold may be a cumulative one indicates that any exposure to cytotoxic drugs should be minimized. The only safe occupational exposure to cytotoxic drugs is no exposure at all. So this picture shows under the UV light the traces of cytotoxic drugs. It may be not visible to our eyes kasi colorless sila, but then it may be visible dun sa mga faucet, sa railings ng bed, and even to even sa mga cart ng nurses. So what is the importance of ensuring safety and protection? So Bruce Harrison has died at the age of 59 at St. Louis in August of a rare cause of oral cancer. So he had never smoked or chewed tobacco. He had no other known risk except he had mixed a lot of chemo drugs for other people in his career as a pharmacist. And siguro familiar na rin kayo mostly kay Sue Crump, who died at the age of 55 due to pancreatic cancer. She had spent 23 years of mixing chemo as a pharmacist. So guidelines for safe handling of cytotoxic drugs. So the objective is to protect the product from the microbial contamination, and also to protect the personnel and the environment from potential hazard of the products. So these are the requirements for health professionals handling chemotherapy drugs. So very important is yung personal protective equipment natin or yung PPE. So first, yung headwear natin, it should have It should fit snugly around the head and be made of disposable, low-linting material. And then the eye protection, you should pull and close the eyes to protect against dust and splashes, and should be washed thoroughly with water after use. So when preparing cytotoxic drugs in a proper biological safety cabinet, especially kung closed glove box type naman, hindi na necessary yung safety goggles or visors. And then the surgical mask, we can use surgical mask if we will use a biosafety cabinet, and if wala namang available na safety cabinet, we should use the N95. Then for the gown, it should be made of disposable lint-free fabric with low permeability to cytotoxic drugs. It should have a closed front, long sleeves, and elastic or neat closed cuff that can be tucked under the gloves. Then footwear covers should be disposable and made of fabric with low permeability to cytotoxic drugs. So everything na gagamitin natin should be disposable and low permeable to liquids. And then the gloves, there's no gloves that are completely impermeable to all cytotoxic drugs. So double gloving is recommended. A double layer offers better protection than a single layer of gloves. Gloves should be removed immediately after overt contamination or if punctured. They should also be changed routinely after no more than 30 minutes of drug preparation or administration. So if the gloves are torn or damaged or contaminated, they should be replaced immediately. Gloves of the isolator must be sanitized with 70% isopropyl alcohol, 70% alcohol spray before and after the preparation of the admixture of cytotoxic drugs. So powder-free gloves are preferred in compounding and also in administering. Then hands should be washed once the gloves are removed. What are the uses of this PPE? In preparation of cytotoxic products, in management of spills, cleaning of biosafety cabinets, and administration of cytotoxic drugs. So procedure for donning personal protective equipment. So later on, we will show you a video on how to do this procedure. So first, we have to remove all the jewelries before gowning. Then wash hands thoroughly. Put on hair cover, tackling all hair inside. So put on the surgical mask. So in doing the donning of the PPE, it should be head to toe. Then choose 2 pair of surgical, put on the gown and the shoe cover. Then choose 2 pair of surgical latex glove that will fit snugly but not impair movement. Put on the first pair of gloves, tuck the glove cuff under the cuffs. Put on a second pair of gloves, then pull the glove cuff over the glove cuff. So if you will be using a closed glove box type isolator, in donning the PPE, we will be using only one glove. Then the second glove is already inside the isolator. Then procedure for removing personal protective equipment. So it will be from toe to head. So remove the outer. First, we have to remove the outer gloves before leaving the clean room. Then remove the booties and the gown. Place it in a cytotoxic waste bin. Then remove mask and hair cuff. Place them in a cytotoxic waste bag. Remove inner gloves and place them in a bag. Wash hands with soap and water before leaving the anteroom. So for work practice control, no eating, drinking, and applying cosmetics at the workstation. Avoiding of spiking and unspiking IV containers of hazardous drugs. All manipulation of prepared chemotherapy drugs. For example, nagkaroon ng problema sa tubing, then kailangan i-manipulate or ipalitan yung tubing. It should be done inside the isolator and do not do it in the administration area or at the bedside. Then proper disposal of cytotoxic waste and proper hand washing. For the administrative control, so policies and procedures, scheduling of practices and other methods that limit number of workers who are potentially exposed, then adequate staffing, training, and education. For the engineering control, so we have to use the proper machine equipment, so the BSC, biosafety cabinet, and the use of isolator. We should have a proper facility where we will compound these drugs. So hindi sometimes hindi yung sa mga beside nung sink natin. So it is not proper. And of course, the use of closed system drug transfer device. Exclusion from the activity. Employees who are pregnant, breastfeeding, or planning parenthood should be aware of the potential risk to the embryo and fetus from the absorbed drug. If possible, they should be offered alternative duties. So our main objective is to protect the personnel and also to protect the product. Then for chemotherapy compounding, what can the patient expect from us? So correct composition of the product, sterility of the product, and correct administration. So what is in compounding chemotherapy drug, it is very important that we use the aseptic technique. So this refers to carrying out a procedure under controlled condition in a manner that will minimize the chance of contamination. So aseptic technique requires special manipulation for syringes, needles, vials, ampules, removal of packaging, assembling of sterile products, and hand placement. So I will be discussing this one by one. The sources of product contamination could be the people itself, touch contamination, generation of particulates from the shedding cells or hair, yung sa mga dala natin sa buhok natin. Then air supply, so it is very important that we schedule regular cleaning of our air condition inside the room. Then infiltrations from the particles from adjacent spaces, yung sa mga anteroom. And internal generation, yung walls, yung floors, yung ceiling, yung packaging, and yung mga equipments na ginagamit natin. So very important na sinasanitize natin sila regularly. So reminders, remove all jewelries from hands and arms. Ilang beses ko nang nabagin ito, yung remove all jewelries. Very important kapag nagko-compound tayo is nothing, wala sa kamay natin, walang ring, walang watch. Kasi these jewelries could be, pwede siyang anuhan ng bacteria, lagyan ng bacteria, magkaroon ng bacteria dito. And pwede natin siya ma-transfer dun sa mga kino-compound natin. Then wash hands before and after preparation of cytotoxic drugs. So, aseptic technique using the syringe. So, the syringe, meron tayong tinatawag na mga critical sites. So, you should never touch the plunger and the lower lock tip of the syringe. Then for the needle, the whole part of the needle should never be touched. So what we need to do is use the forceps in touching this touching the needle. So never touch any part of the needle. Open needle package within the hood to maintain the sterility. And then in addition, lower lock syringes are preferred for chemo drug preparation, and the use of large bore needles for gauge 19 or larger is necessary to prevent the generation of high pressure within the syringes. So for the vials and ampules, so we should be aware of coring. Ito yung rubber na pumasok na mismo dun sa vial kapag nag-aspirate tayo, pag nag-insert tayo ng needle. Then we should swab the rubber closure with 70% alcohol using firm strokes in the same direction. Hindi siya paikot-ikot yung pag-swab. The negative pressure technique is a must in compounding chemo drugs. This is used to minimize aerosol degeneration and to minimize spill. So never tayo gagamit ng air exchange kasi it could cause spillage, or if you already experience yung sumisirit kapag nag-air exchange. So for ampules, to break an ampule, so clean the ampule neck with alcohol swab, keep swab in place, grasp ampule neck with thumb and index finger. So yung swab na gagamitin natin is nandun lang siya sa ampule neck, and then at saka natin siya i-grasp para ma-prevent din kung halimbawa madurog yung ampule, is hindi tayo mabububog. Then use quick firm snapping motion away from the body towards the side of the wall. Then do not break towards the HEPA filter. Then labeling, the label should be correct and it should be double checked. So there should be at least 2 identifiers, generic and brand name, then with the dose of the drug, the expiration date, the precaution, the date and time done. This is very important because sometimes naho-hold yung infusion ni patient. So at least the nurses would know anong oras po pwedeng, hanggang anong oras or hanggang kailan po pwede nilang gamitin yung na-prepare na gamot, and also the one who the signature of the one who prepared the drug. So in removing packaging, so any sterile component or supply, these are the syringes, the needles, and the ampules, should only be opened and or removed from their packaging within the laminar flow hood. So when opening the wrapper on a needle, it should be peeled open. Tearing papers introduces paper particles into the hood, which could lead to product contamination. So never tear any paper lalo sa laminar flow hood natin kasi pwedeng magkabara yung HEPA filter nila. So it is important that hand placement during aseptic manipulation is such that laminar airflow is not interrupted. So dapat magka-adjacent lang yung hand placement natin. And then critical sterile fluid pathways. Great care should be taken to avoid contact with the syringe, plunger, especially during multiple manipulation. So using the same syringe, since the plunger enters the barrel of the syringe during repeated use, contamination can be accidentally introduced into the barrel. For the waste disposal, 2 plastic bags that are at least 2 mm thick should be used to collect the puncture-proof plastic containers, gloves, gowns, alcohol wipes, and all other potentially contaminated materials. Excreta from treated patient may contain unchanged cytotoxic drugs or active metabolites. So ito yung mga urine nila, even nga yung sweat nila could have active metabolites of cytotoxic drugs. So when handling this waste, including waste from treated patient, staff should wear suitable PPE. So the bag should be color-coded to distinguish them from regular rubbish and labeled with a cytotoxic warning label. So, I think orange yung international. Yes, orange yung ginagamit namin for the cytotoxic waste. Then storing and transport, areas where cytotoxic drugs are stored should be separated from regular storage and clearly marked with a cytotoxic label. Then clear warning labels should be used to identify the cytotoxic drugs and point out their hazards. Drugs should be securely capped and sealed and should be packed in impervious packing materials. Labels of all boxes, containers, and vials should indicate that the substance is a cytotoxic drug. Especially kung malayo yung ita-transport ng gamot. So very important na it is correctly labeled. So all cytotoxic drugs must be hand-carried to their destination. So transport methods that produce stress on content, such as the pneumatic tube or telecar, should not be used to transport cytotoxic drugs. In managing the spills, a clearly labeled cytotoxic spill kit should be kept wherever cytotoxic medications are being prepared, stored, administered, or received. Ibig sabihin, pati sa mga warehouse natin, kailangan meron din silang spill kits. Then any person at the workplace who may potentially handle a cytotoxic drug should receive this training. All spills should be immediately marked with a warning sign to prevent exposure to other workers. Glass should never be handled by hand, always use the scoop. The cleanup should be reduced to as few people as feasible, but there should be at least 2 people involved. So these are the contents of the spill kit. So fit tested NIOSH NIOSH certified respiratory of the N95 mask. You should not use the ordinary, the surgical mask. Then at least 2 sets of chemo gloves or surgical gloves. Then eye protection and or goggles, the shoe cover, the gown and the head cup. So in short, yung proper PPE should be used in handling spill kit. Then scoop and scraper. Actually, pwede na rin yung disposables po natin could also be used. Basta never touch ng bare hand. Then sharp containers, 2 large plastic disposable bags, a clear warning sign. So before anything else, bago nyo i-prepare mag-PPE, lagyan agad ng warning sign yung area kung saan nagka-spill. Kasi medyo matagal din magsuot ng PPE. So, baka mamaya natapak-tapakan na yung mga area kung saan nagkaroon ng cytotoxic spill. Then decontamination agent, basic detergent of pH 8 to 9, water and 70% alcohol. So if wala before kasi may ginagamit yung decon, so hindi na siya available, I think hindi siya available dito sa Philippines, sa Philippine market. So we can use the 1% hydrochloride solution and then absorbent materials. So that's all. Thank you for listening.
Alright, so thank you very much, Miss Rona. So you will be hearing from her in the interactive session in the succeeding portion of our program for today. Alright, so if you have any question, feel free to use our question and answer box and button below, or you can type it in our chat box for more easy communications. Okay, thank you, Ma'am Rona. I'll see you later. Alright, so we've discussed about preparation and compounding of hazardous drugs, particularly in chemo, safety. And now we go to the second session